In 1980, Oakhurst Medical Center was not much more than a pipe dream for Decatur Mayor Emeritus Elizabeth Wilson. But what a dream it was.
The vision was to help individuals in that Oakhurst community that didn't have access to health care. And they didn't have access to health care because either there was a shortage of doctors or they just didn't have money to go to the doctor.
Oakhurst started with very little funding and a staff of only a couple of volunteers. In 2015, it is a different story. The federally qualified nonprofit center has 3 centers in Stone Mountain and Decatur and 1 in Conyers. This includes the 5,027,000 square foot state-of-the-art facility in Stone Mountain that serves as its home base. In addition, Oakhurst served approximately 18,000 patients in 2014 and has a full-time staff of 80, with 15 of them being physicians and mid-level providers.
I can't tell you how rewarding it is to be able to provide medical services in the community. Each day we probably have anywhere from 75 to 100 people that just walk in off the street who need health care services. They couldn't make an appointment, or they didn't make an appointment. They walk in and say, I need to see a doctor today. And I think the benefit is that if we weren't here, they would actually go to the emergency room. And in the emergency room, they would just take care of whatever their need is that day. But we can take a more holistic approach and provide a medical home for the patient.
With implementation of the Affordable Care Act, Oakhurst took a proactive stance in securing a federal grant to help enroll the uninsured citizens in new health coverage options.
Yeah, community health centers are the axle upon which the whole healthcare system is being reformed now. It's moving us away from sick care to well care. So in other words, the community health center is there promoting people coming in, getting annual checkups. And they've been doing this for long before the Affordable Care Act was passed. Using these community health centers for things like emergent care and things like prenatal care for mothers. And now that the Affordable Care Act has passed, it relies upon that basic infrastructure that was already in place, and then putting additional resources, federal dollars, to promote these community health centers' ability to render even greater care.
In addition to helping the uninsured become insured, Oakhurst took yet another forward-thinking approach in 2011 by partnering with the DeKalb Community Service Board to provide health care services to DeKalb's CSB's behavioral health patients. Oakhurst now provides OBGYN, pediatrics, family medicine, and dental services for those in DeKalb and Rockdale counties who need it the most. The work that Oakhurst has done over the last 35 years has not only impacted individuals, but also generations of families.
You can't begin to estimate how many lives were saved, how many lives were enhanced because of the medical care that people received from Oakhurst Medical Center.
Quality, affordable health care is the battle cry of the 21st century. For the underserved of our community, it has now become a reality because of the dedication and progressive nature of the leadership and staff of Oakhurst Medical Centers.